Hi, my name is Talia and I'm going to be doing my video on elbow humeral ulnar flexion. So what are the muscles involved in elbow flexion? The primary ones are the biceps femoris, brachialis, brachioradialis, and pronator teres has a small role as well. So before I get started with my video, I just want to talk a little bit about normal elbow range of motion. The position that you're going to have your patient in to look at this is supine. You want to make sure to have a towel under their distal humerus for stabilization and also to allow for that full extension. Normal extension is actually anywhere from -5 degrees to 0 degrees. And normal flexion range of motion is about 145 degrees. However, I do want to point out that this is different than functional range of motion, which we need to actually do functional activities. And the functional range of motion lies between 30 and 130 degrees. The last thing is a normal end feel can be one of two things. It can be a soft end feel if they're strong or have some tissue getting in the way of that end feel. Or it can also be hard if they maybe have a smaller arm and those bones are coming into full contact. So we're just going to take a look at what that range of motion looks like. I'm going to start by putting this towel underneath your arm just to keep it in place. And I'm going to bend your elbow, so I'll stand up here. And I'm going to stabilize here and bend the elbow, just see where we get. So for resistance training, we're going to be doing some bicep curls to increase that flexion or the strength in that plane. In terms of the frequency, we want about 8 to 12 reps for 2 to 3 sets for about a total of 30 minutes, 3 to 5 times a week is good. Intensity, low to moderate, so we don't want to strain our patients too much, but we also do want them to improve in strength. So whatever that customized level is, that's where we want to start them. And then the type, we want to make sure our patients are doing a controlled movement, both concentric and eccentrically. This specific exercise is dynamic. It uses a mechanical load, and it also has a constant load, meaning that it's the same weight throughout the entire movement. For their home exercise program, if they do not have a dumbbell, they can also improvise and use something like canned goods. And it's also really important to inform the patient or teach the patient exercises for the antagonist muscle as well. This will help to avoid injury and also stabilize the joint. So what I'm going to have you do is do a bicep curl for me all the way up to the top, shorten that muscle as much as possible, and back down to the table. And aim for those controlled movements. So just give me a couple here. And we're going to aim for about 8 to 12 reps, 3 to 4 sets, ideally about 3 to 5 times a week. So a few quick notes on stretching. In the next video, we're going to be taking a look at increasing elbow flexion through the use of a tricep stretch. So if we stretch the tricep, this is most beneficial for patients with contracture or shortening of the triceps in order to gain some of that flexion back. Some benefits of stretching is preventing injury if performed consistently, and also it can decrease some soreness. When applying the FIT principles to stretching, we're looking at doing 2 to 4 repetitions for about 15 to 60 seconds. We really want more of a low intensity, constant or higher time. And the type is a passive stretch, either done by the physical therapist or someone else, or it can be done independently if the patient's able to. What we're going to stretch out is your tricep. So we're going to start off by bringing the arm into full flexion. And then we're going to bend this elbow here. I'm going to stabilize at the scapula, and I'm going to hold here and provide the stretch through the elbow joint. We're going to hold this for about 20 to 30 seconds, and then we can relax. So the mobilization that I chose for increasing elbow flexion was the humeral ulnar distal glide. So in terms of stabilization, we're going to place a strap across the bicep to prevent any sort of forces going through the shoulder. If a therapist does not have a strap, they can also provide this stabilization with their hand. However, the advantage of having a strap in this situation is that you can also provide partial stabilization along the radius or the thumb side of the arm, and make sure that the forearm is moving equally through that motion. So the starting position is in supine with the elbow at about a 45-degree angle, and this will actually increase as the patient progresses through that flexion. The last thing is that this motion is concave on convex, so it's actually the olecranon moving on the trochlea. And because of this, we're gonna do a glide in the same direction as the mobilization force. All right, the last thing we're gonna be doing is a mobilization to increase flexion, a humeral ulnar distal glide. So what I'm going to be doing is stabilizing on the radial side and mobilizing on the ulnar side, so the pinky side. We have this belt here to stabilize her arm, and the movement that I'm going to be doing is a combination of distraction and scooping, so it's going to look something like that. So I want to make sure my line of pull is correct, and I'm going to go ahead and do one version or just one of the sustained mobilizations. So I'll distract and scoop, hold for about 5 to 7 seconds, relax, and do the same thing and repeat it.